Come on, show up, please. Sam!
Hello.
Sam, kita mo kami?
Yeah, I can see you all.
Oh, okay. Well, at least you can. Okay, now we can hear you.
Okay.
I'm not sure if this is okay. I don't know if this counts, but okay. Well, I don't know. It's kind of weird, actually. Like, because this is my first time interviewing somebody, and having this, like, actually using Skype for it. Oh, okay. There we go. Sweet. Okay, now we're complete.
Ask
Okay.
away.
All right, so I guess we will just
We go and
how to do
introduce
this.
ourselves or not?
Sure. Brother Robbins, are you okay with everybody? Like, do you have any questions before we maybe start the official?
No, I'd be happy to share whatever information you need.
Okay.
Just ask. I'm
All right,
easy.
so we will have Sam to actually. I don't know, Sam. Do you want to record the official interview?
I'm already recording it.
So I'm not sure how we're gonna do it though. So like, would this be okay? Like, because I don't know how to do the interview. But anyways, we'll just start. So Brother Robbins, we have maybe a few questions for you, like prepared
Okay.
for chiropractic. So maybe I'll start. Well, this is actually my questions, but I know they have questions too. So maybe I'll ask first. So maybe the first question will be, what's about chiropractic that?
Chiropractic.
Oh, sorry, chiropractic that would, I guess people would benefit, like in general.
Yeah. So most of my patients come for neck and back pain and headaches. So we do some work. Some chiropractors specialize in extremities, shoulders, knees, and stuff. But the majority of them, it's for neck and back musculoskeletal problems. They benefit from because they have more range of motion. They can. I have a lot of people who get injured on the job. I have a lot of personal injury cases, automobile accidents, people who've been injured that way.
So do they get like instant relief, or
Yeah, the
most of the
great thing
time?
about chiropractic is sometimes people walk in, they've had a headache for 2 weeks. You give them an adjustment, boom, they're better. It's awesome.
Like, is chiropractic a one-time deal, or are you supposed to come back regularly?
Yeah, so a lot of people come in on a fairly regular basis, depending on what the condition is. I mean, some people come in 2 or 3 times a year. I just saw a lady I haven't seen for 5 years. She came in once, and she says, I'll come back next time I have a problem. Other people, when you're trying to do a spinal correction, when you're trying to change curves, or if it's been a chronic problem, they may come in for 2 or 3 months. And then it's kind of like maintenance, you know. You get a car, you get a lube oil filter on your car 2 or 3 times a year. You know, some people take better care of their car than they do of their body. This is the same body you're stuck with for life. So it's like a tune-up. It's like you come in occasionally, you tune things up, you get things moving, and then works great.
Oh. Okay, so it's more of it's a preventive.
Yeah, a lot of preventative and corrective.
Corrective.
Does it affect or enhance or help us in improving our 5 senses or sensing our places around us?
Yeah, you know, it can. That's not a, you know, if a nerve, we're trying to relieve or improve energy from nerves. So if the nerve is compromised, whether it's to your ears, whether it's to your eyes, I have patients who come in who swear they can see better after they get adjusted. They see brighter, lighter colors and things, and so they, you know, that's not in the classic definition of chiropractic. But what we're trying to do is we improve your nervous system wherever the nerves go, that can be enhanced and improved. Does that make sense?
Yes.
Yeah. Made a lot of difference, huh? Just from adjusting like a piece of the misaligned bone. Okay. So I didn't really actually know the science behind it. Like I just remember like when you, I don't know, when you adjusted me, like maybe once.
Oh, right.
Yeah, I don't know. It just feels different, I guess. I don't know. I can actually, yeah, I'm just
So,
happy because I was like, I never heard of chiropractic before, and I just had one.
That was very courageous of you to jump on the table.
Yeah, because here in the Philippines, it's, I don't know, maybe it's just we have this what do you call that, guys? It's not a superstition, isn't it? Is it a superstition or is it just a belief? Maybe a belief that, I don't know, because we call, there's a person that's called masajista or a massage person.
Yeah.
And then most Filipinos think that that person can do
Everything.
like, can do everything. Like, can help. You just need to call the person.
Same thing in Mexico.
He will work for you, you know. Like,
in Mexico, in fact, there's tons of Mexicans around Los Angeles, right?
Yes.
So they have, in Mexico, they have what they call a sobador, which is probably like your manzanista, whatever, you know. And it's the same thing. They do. Now, the difference between a massage and chiropractic, massage just works with the muscles. Chiropractics, we're adjusting the joints, the bone.
huh.
So,
Yeah. And obviously they don't have.
yeah.
Like,
But, you know, if you look at I'll follow you along here. You want to follow along? I'm in my office now. I don't know what you can see. There's the chiropractic table.
look at that, guys. Yeah.
Right. Here's like a spinal nerve chart. But if you look over here, you can see all the nerves that come out of your spine go to all your heart. They affect your lungs. They affect your stomach. They affect your pelvic core, your colon, your bowels. And then I'm a clinical nutritionist. So this one talks about how different segments, sugar handling problems, your liver, your heart, your stomach, your spleen. So that's just based on the science of where the nerves go. So certain segments correspond to certain areas of your spine.
So chiropractic care really does affect your whole body.
It certainly does.
Yeah.
So I have scoliosis. I have scoliosis. So I was wondering if can chiropractic cure scoliosis or like?
Yeah, it depends. There are two kinds of scoliosis. One is compensatory, which means you compensate for, like if your pelvis is like this, the spine's going to start like this. That's compensating for a pelvic inefficiency.
Oh.
There's another kind that's makes no sense. It's called idiopathic scoliosis, which means if your spine's like this, but it starts off the opposite direction. I haven't seen much success correcting spinal curvatures when it's the poorly compensated scoliosis. But one that is well compensated, you can absolutely improve and change spinal curvatures. Welcome back, EM11. He's been missing for a while.
Sorry.
There goes Sam. Now Sam's gone.
I'm here. I'm still here.
Okay. Oh.
Next question.
So is there, I don't know, I guess, can chiropractic help? Well, how does chiropractic help dealing with stress? Is there a...
Stress, if it's a physical stressor, means what? You have tight muscles. You have tension and stress in muscles. So if the adjustment relaxes the muscles and takes away tension, in that definition, it relieves stress. If the stress is from nervous stress, as you relieve nervous tension, you feel better. You feel relaxed after you get adjustments. You know, another thing that an adjustment does, when you hear all the cracking of the joints moving around, you get an endorphin release, which is like euphoria. You've got to go to the gym and work out for an hour before you get endorphins. You get an adjustment, you have an endorphin release right then. It's like a drug.
That's why you feel it afterwards, huh?
Yeah, that's why adjustments just feel good. People love to come to the chiropractor because they walk out feeling like they're on cloud nine. They feel excellent.
Instant relief.
Instant relief.
Yeah.
Like I said, I've had a dozen patients this morning, and pretty much all of them felt better when they left the room. So it's kind of, for me, it's gratifying. You know, you go to the dentist, you feel like crap. They hurt your teeth. You go to the doctor, they give you a bunch of pills. You never know what's going to happen. You never see them again. But in my office, you get immediate feedback.
Mm-hmm. I guess that's what chiropractic does the best. I guess it's you get into the root of the problem instead of, you know, like taking all these medications and.
Can be. I'm not a big fan of drugs.
Early.
So a lot of chiropractors are also heavily involved in nutrition. So I'm also a clinical nutritionist. I have my diplomate degree in nutrition, and so I deal a lot with diet and nutrition, herbs. So I use a lot of different supplements to help different organ systems, whether we're working with the heart, whether we're working with blood sugar and diabetes, digestive problems, energy problems, fibromyalgia. So chiropractic and nutrition for me go hand in hand. So I do as much nutrition as I do chiropractic.
That's smart. Yeah. So is there different? So were there like different types of chiropractic, like chiropractic?
Yeah, there are many different techniques.
Okay.
I practice several techniques in my practice. It's called a drop table, Thompson drop table. I use some blocks. Sometimes the one's called an activator, where you use a little instrument.
Mm-hmm.
So right here, this is an activator instrument, and it just does a little impulse and a little adjustment type. But the classic chiropractic is with your hands. The word means done by hands. So, but other people use different instruments, like a little baby or an old osteoporotic woman or someone who's in a lot of pain. You can't move them around; it would kill them. So there are other techniques. We use therapy. Chiropractic is trained in all the things that physical therapists learn. So we have muscle stimulators and ultrasound machines. We give people stretches and exercises that they need to do to, like, build your core or strength or stretch out certain muscles that are over tight.
Mm-hmm.
So it's not just adjustments. I mean, there's therapy involved as well sometimes.
So is there a certain age where you can be eligible to go to a chiropractor?
Yeah, I adjusted an 18-month-old baby yesterday. That's because they had a problem or an issue. I would say if kids are healthy, you know, a lot of kids come in when they're 3 and 4 or 5. Think about this. When you're learning to walk, they say you have about 4,000 to 5,000 falls. Think about how many times people fall and land. What are the reasons why? Well, if you land and it affected your spine, that might be why Ian has scoliosis. If he lands, it starts, as the tree is bent, so grows the branch. So I can do more with a little kid in one adjustment than I can with an adult in 20. So kids love adjustments because they feel better. You know, I adjust all my children. I have 6 children. They've been adjusted since they were 2 years old.
Oh,
And
sir, about the nutrition, does it affect one's or the patient's outcome once they taken chiropractic treatment? Like, if a person is diabetic or somewhat malnutrition, does it affect the outcome of the procedure?
What we're trying to do is we're trying to help people become healthy naturally without the use of drugs. Now, if you're going to die, you should take some drugs. You know, drugs do not make anyone healthy. They change and manage your symptoms. It's through proper health and nutrition, you know, that and the proper care of the spine that people can become healthier. But I mean, a lot of people continue to use drugs. I mean, if you're a diabetic, you know, if you're a type 2 diabetic and you're insulin dependent, chances are you're never going to be off that. But if you're borderline, I've helped people off a lot of medications. I've helped hundreds of people off medications who now are healthy without medication. But sometimes you might need it to sustain your life. It's not the end of the world, but the idea is to become healthy without it.
Okay. Well, talking about like medication, so does going to chiropractic, does it save you money or does it cost more? Like in a long term.
Yeah, in the long term, the healthier you are, the less need you need of medical care, the more money you'll save. It's like preventing for your car. Do you want to get a lube oil filter and get your spark plugs changed, or do you want to get an engine overhaul? Which one's going to cost more money? So we try. There's been several studies that show that people are healthier, that they have less work injuries, that they have less missed time off of work when they receive regular chiropractic care. That's a documented fact.
So, speaking of work, may I ask, does it affect the performance of the body, especially the five senses?
I didn't quite get that. Does it affect what of the body?
The performance of the body.
The performance of the body. Yeah. A lot of professional sports teams have chiropractors on the staff because they have improved performance. A lot of different professional athletes, very famous athletes have, Tom Brady, who's the quarterback of the New England Patriots. A good friend of mine works on him routinely. In the Olympics, they have chiropractors on the Olympic training teams. Many professional sports teams in America have a chiropractor on staff. I've adjusted some professional basketball players just because I'm tall and I know some tall people.
Brother Robbins, can you? Well, because we kind of talked about it at the beginning, but why do you think like chiropractic is not that known? I mean, in like third world countries or like
well, it's
Philippines
hard to be known if people are not going. There's not a school to learn it there, so it's hard to teach it. So unless someone's going to go to America and spend all those hundreds of thousands of dollars getting the education and go to the Philippines and do chiropractic, it's not going to happen. But there are Filipino chiropractic students in American schools. So whether they're going to go back to the Philippines or whether they're going to stay here, I don't know. But it's known more here because that's where the schools are. That's where the training is. Mm-hmm. But like I say, it started off just in a small one school 100 years ago. Now there's dozens of schools, and it's all over the world. So it is growing internationally.
Well, I guess that's
That's
is that good? Do you have any other questions, guys? Yeah,
okay.
guys,
Okay.
have other questions or?
No.
Anything else?
Thanks for the time.
Not a problem. You guys are awesome. Good luck on your assignment.
Okay.
Thank you.
Yeah, that's all, Brother Robbins. Well, yeah, we want to give you something though in return, but you're too far.
Give me a nice-
But I guess we'll give you credit though.
Attaboy.
Yeah.
All right, good luck, guys.
Okay, thanks.
Yeah, how will turn out.
Ciao.
Thank you.
All right, thank
Bye.
you. Talk to you later.
Thank you.
Bye. Okay, guys.
Dude.
Hey,
Ano, na-record nyo.
Nice.
Oh,